Hello, my name is Thomasine Ricks, and I am here today with Dr. Michelle Gamble and Sankofa, as I am a prior client, current client of hers. And as we work on, or as individuals work on making things better in their lives, health has to be a part of that. It has been that for me. It has been a journey as I'm trying to work on my own personal health. But then I know from my own experience that there are challenges that go along with that. And I have some questions that I think some of you may have um, some concerns about. And I'd like to take this time to ask Dr. Gamble if she would to allow some time to answer those most frequently asked questions. Questions I know you have, but you just don't know how to get it out or what to ask as it relates to Sankofa and the services that are provided by Dr. Gamble and her staff. And so, welcome, Dr. Gamble. Thank you for allowing me to ask these questions. And can I just kind of start out with just getting a feel for when I came to you, I had some concerns, questions, health problems, and I know that there are others out there with the same kind of questions. And I just want to get you to answer the question, what should anyone with any type of health problem, wherever they are in their process of addressing their health concerns, what should they expect in a preliminary consultation with you and the staff at Sankofa?
Well, first of all, I want to say thank you, Thomasine, for being a part of this. You're very modest. That's the first thing I want to say, because you have been a student working on your health for, oh my gosh, has it been like 10 years? Over 10 years.
At least.
And I think you are the perfect example of what people can expect. What you can expect is the beginning of a journey that will continue throughout your life. During a preliminary consultation, the first thing we do is get to know you, get to find out what is it that is challenging you right at this point in time, and to find out a little bit more about some of your symptoms, some of the difficulties that you're facing, as well as looking at what are the different things that you've tried. You know, most of the people who come to Sankofa, they've been through several different practitioners, and most of those practitioners are very good in their own right. And, you know, so I need to know a little bit more about your journey and what it is that you've been going through, and more importantly, what your goals are. So that's what you're going to expect during a preliminary consultation, for us to get to know that little bit of information about you, looking at what your goals are, looking at what your symptoms are, and most importantly, to give you an understanding of how we could possibly assist you in your journey. Or maybe it may be a case where I say, you know, I think I want to refer you to one of my colleagues, you know, because I cannot assist every single person there. And I want to be very transparent and upfront from the very beginning. And last but not least, to give you an idea of how long it's going to take. You know, again, for most of the people who come to me, they've been dealing with chronic issues for a long time. So we're not looking at a quick fix. We're not looking at something that's going to take, say, a couple of weeks. More than likely, we're looking at something that's going to take at least 3 to 6 months. And for some people, maybe even as long as a year, because the problem, the root causes are so deeply ingrained in their persons.
Yes, and I remember that completely. Whenever I came to you, there was that prelim that kind of, where I had to really delve into what I was dealing with, and it went deeper than just what I was dealing with on the surface.
Mm-hmm.
I remember that so well. And there will be people, I heard you say, that will come to you and you're trying to figure out if you're the right match.
Mm-hmm.
What would you consider to be a person that would be a good candidate for your program?
A person that's a good candidate is the person who has come to the end of the rope, you know, and said, you know what, enough is enough. I'm sick and tired of being sick and tired. I'm tired of popping pills. I'm tired of just dealing with the symptoms. And I really want to get down to the root cause, because I consider myself a roots doctor. You know, if you want to find out what's at the bottom of that excavation site, I'm the person to come to, because I'm going to be that detective. The other thing is that the person who's going to be a right fit for Sankofa is someone who realizes that health is not simply about popping pills. Health isn't even only about, eating organic foods and grass-fed chickens and things of that nature. Health, a big part of health is learning to deal with our stress and learning to acknowledge the things that drain us emotionally, mentally, physically, as well as spiritually. So the right fit person is someone who is going to be willing to make that journey within, because really and truly, your healing has to come from within. I am just a guide. I'm just a facilitator. You're going to have to do 95% of the work. Sorry to tell you this. You're going to have to do 95% of the work. But the flip side of it is that I give you 100% credit, because nothing I do is as important as what you do.
And also the benefit, 100% of the benefit.
You get 100% of the benefit. That's
100% of the benefit goes to the client. But then I know too that, people have been, for the lack of a better phrase, bamboozled by certain physicians, medical systems, and a lot of that has resulted in the same symptomology and a lot of costs that went with it. What is exactly, your initial fee for your preliminary consultation?
Well, the preliminary consultation, since it's just a matter of us getting to know each other, really, and finding out whether or not it's a good fit, the preliminary consultation is just $50, because I don't want that to be a barrier, because I don't want you to invest a lot of money and then you say, I don't think I'm ready for that right now, or maybe another day. So I really want to give you an opportunity to remove those barriers of finances, to get to know me, for me to get to know you. And if it's a good fit, we'll apply that $50 to the balance of your program that's, coming up.
Sounds like a win-win situation, because go ahead.
And at the very least, even if you decide not to work with us, my hope is that you will gain some insights during that preliminary consultation that gives you some direction as to what to do next. Like I said, I may even refer you to a fellow colleague and say, you know what, I think that you need to really talk with a chiropractor, or have you considered working with such and such a professional? Because again, I am not the perfect fit, or Sankofa is not the perfect fit for everyone in their health journey at this particular point in time. And my priority at all times is what is in your best interest.
Yes, and I've known you, like you said, all these years, and I know that to be true. You're more concerned about what's going on with the client and making sure that their health issues are addressed, and that they do walk away with that kind of hands-on knowledge where they can continue. Unlike walking out of a physician's office or the ER and you walk out with a script, and all you can do is pop pills and hope for the best kind of thing. I'm not talking about what I think, I'm talking about what I know, and that's why I threw that in there. But anyway, so as a potential client, what might they need? What do they need to do to prepare? Do they need to prepare any kind of way? Do they need to bring anything if they decide to set up the consultation with you?
Well, at the preliminary consultation, the only thing you need to bring is yourself and an open mind, and I would say a piece of paper and a pencil or a pen, because, as I referred to you in the beginning, you're going to be a student. We are all student of life, and I also am going to be your student, because I'm going to be learning from you. And so I want you to document the journey from the beginning, and as we progress through the days, the weeks, the months, and maybe even the years.
While you were talking about that paper, and I know it's not one that I prepared you for, but when I go into the doctor's office, or when I go and I've not been in a while, one of the things that they make me do is to fill out paperwork that kind of gives them a general idea of, first of all, what my insurance company is. But anyway, that's irrelevant. But what's going on, if things are pretty much the same. So I guess the question is, is there any type of paperwork that they should look forward to filling out when they come to see you? Because I think I remember you filling out some paperwork.
Well, since your time, because that was a long time ago when you did the preliminary consultation.
Right.
Back in the day,
right.
we did have paper and pen, but
right.
now we've become a little bit more technologically advanced.
Okay.
What they will be filling out is a metabolic assessment online, and that's done through a Google form that you can access on the website. Once you go to the website and you click on healthcare, you'll find the leads to go to the Google form. And once you complete that form, actually, that is when you would go back to our online scheduler and book your preliminary consultation. Mm-hmm. Now, if you decide to continue with us in one of our health assurance programs or the health restoration program, then you're going to be completing several different intake forms that is going to really give me a much fuller understanding of who you are and the journey that has led you to this point in time. So it's a process, but initially, before the preliminary intake, or should I say before the preliminary consultation, there is that Google form, which is a metabolic assessment form that will be completed.
Okay. And I guess that gives you a lot of insight before you actually meet with the person. So when they meet with you, what kind of time are they looking at as far as spending with you in the preliminary consultation?
In the preliminary consultation, it's basically just a 25-minute consultation, and that's done either by phone or by us engaging in a Zoom room, pretty much like this interview. And it's very short, sweet, to the point, because again, it's just preliminary. Now, if they decide that they're going to do a more involved program, that would lead into what's called the Sankofa discovery session. And the Sankofa discovery session is a 90-minute consultation in which we do a couple of things. We look at the extensive intake forms that you would have completed prior to that consultation. And we also look at any preliminary lab results that you have on hand from prior contact with other health professionals. And during that Sankofa discovery session, we also look at whether or not there are other labs that we should look into ordering. So those are the things that are done during the discovery session. No kind of suggestions or recommendations occur during the Sankofa discovery session. We wait until we get all the labs in, and I have time to really review and reflect all the information that you've given to me during the 90-minute session. And then we call you in for what's called a report of findings. And during the report of findings, that's when we lay out the plan and we say, okay, this is it. We're going to go for the gusto. And we lay out a plan that includes our 3-tiered levels, which is we start out with detoxification and cleansing. We then go into a rejuvenation plan. And ultimately, our goal is to get you into a maintenance plan.
Sounds deep. You do your research. You do your research. Can I say it one more time? You do your research.
And it's a lot of research, because think about it. Most of the people who come to me, they're in their 40s, 50s, 60s, because most people who come to me are very mature in terms of how they approach life and what they want to accomplish with their health. So that means that we're talking about 40, 50, 60 plus years of history that led to where you are now. And when I say that I look at all of that, I look at all of that. This is not a case where, like most of the times you go to the doctor, you fill out all these wads and wads of paperwork, and you go in for your appointment, and in the 5 minutes that you're there, she asks you the same questions that are on the form that you just completed, and you're wondering, did you even look at what I said? No, this is not what this is. We're going to go back literally, and I'm not being figuratively here. Literally, we're going to go back to birth. I'm going to ask you questions such as, did you have a cesarean birth? or were you a vaginal birth? Did your mother breastfeed, or were you formula fed? You know, going through all of the different childhood illnesses that you can recall. Or I've had clients that say, you know what, I haven't spoken to my mother in months, and I had to call her in order to fill out your form. I was like, yes, that's good. You need to talk to mama. You need to talk to dad. You need to find out what happened throughout your childhood. I cannot tell you how many times I deal with people who have issues that began in childhood. And because those issues were not dealt with in terms of their root causes, they never saw true resolution and never experienced real, true, lasting healing.
Yeah. And all that research and the time that it takes to look at all those things, it's taxing for you, but then if you did it in any other arena, or in every arena, it comes with a price. So I guess in other arenas, they accept insurance. Does your office accept insurance?
Unfortunately, no. Unfortunately, the insurance model is really a model of maintaining disease. And that's not what we are about. We are about eradicating disease. We are about promoting health and wellness. And as you said, we like to consider the money that you're spending as not being a price tag, but rather an investment, because you are investing in your future, in your health. You know, this body that we have, we only get one. You know, it's not like a car. You know, if you bang up your car, you total your car, you can go get a new car. You know, if your house burns down, God forbid, you can get a new house. But this body, this is the only one you're going to get. This mind, that's the only one you're going to get. This heart, that's the only one you're going to get during this lifetime. So it's important that we really turn around our perspective on how we deal with health, to view our health and to view ourselves as being worthy. You know, I deal with a lot of women in particular where we will spend thousands of dollars on other people, from the men in our lives to our children. And we find it very hard to spend money on ourselves. Now, we may get the hair done, we may get the shoes, we may get the nails, but when it comes to our health, oh, we sacrifice our health, and we come up with all kinds of excuses why we can't afford it, and yet we will spend money on other things. So going back to a question that you asked me before in terms of the right fit for Sankofa, the right fit for Sankofa is someone that thinks, you know what, I am all that. And I deserve to have the best in healthcare. And unfortunately, at this point in time, 9 times out of 10, the best in healthcare is not through the insurance model. Now, the best in disease maintenance is definitely through the insurance model. If you want a pill to pop, if you want some surgeries to go under, that's the best place to go. But if you really want to delve into healing yourself, really and truly from the inside out, both from physically, mentally, emotionally, spiritually, then it's going to come with a price tag that unfortunately insurance companies are not willing to pay.
Yeah, so it really sounds as if you really try to pull all the different tests and all that goes with, that's a part of the insurance model that you can get from different doctors' offices. And I think I remember doing that in my own personal experiences, going to the records department and when my son was in the hospital, getting all of his records, getting all of his blood work and all that kind of stuff, and bringing it to you. And so I guess the question is, what about, is that pretty much the same as far as the blood work that you need and insurance and lab tests, and how does that play into if insurance is not accepted?
Well, that is a very good point, because I am always trying to find a way to make things more affordable. And if you're paying good money for your insurance, you might as well get something out of it. And so with my clients, you know, as I said, during the preliminary consultation and also during the Sankofa discovery session, we talk about labs that would be beneficial to getting more insight into exactly what we're dealing with. Because one of my mottos is, lab test, not best guess. I'm not in the business of playing Russian roulette, and I'm not in the business of guessing. You know, a lot of people go through little symptomology charts and things of that nature, and those are good, and they have their place. However, I'm a scientific mama. You know, I want to see the numbers. I want to see scientifically, objectively, what's going on with the people that I'm dealing with. And so whenever possible, I tell people, you know what, go to your primary care provider and ask them if they will run these labs. Go to your primary care provider and ask them if they'll do this hormonal panel, do this stool sample, do this urine test, whatever it is. If we can get the primary care providers to sign off on it and for the insurance companies to cover it, that's fine with me. Unfortunately, sometimes they're not able to do so, or sometimes, you know, your copay kicks in and, you know, you have, say, a $5,000 deductible that you have to meet, and so you end up having to pay for the test anyway. But we really try to avoid having you have to come out of pocket for things like tests.
Mm-hmm. I think I remember from my own experiences too, going and asking if a certain panel could be added to what the physician already wanted to run. Mm-hmm. And his question was, why? Mm-hmm. I don't have a reason to do that. I don't have any justification to do that. And so it's good to know that I think in the past you have been able to request panels. Mm-hmm. Through lab testing sources and that kind of thing. So, and so that's a good thing. So tell us a little bit more then, even as we put all that together, what is exactly the Natural Health C.A.R.E. program? And what's the initial investment in that?
Well, the Natural Health Care program, CARE stands for Customized Accessible Resources and Education. And that is what I do. I am here to empower you. I was just speaking to a friend of mine this morning, and we were talking about the fact that ours is the age of information. And unfortunately, with the internet, with Dr. Google, you know, you go on to Dr. Google and you ask about certain symptoms, and you think that you've got everything from syphilis to diabetes, you know, because everything has a whole plethora of different symptoms. And I guarantee you, you can diagnose yourself with at least 50 diseases out there. Wow. Same thing with psychiatry. Every single one of us has some kind of schizophrenic or some kind of mood disorder that can be diagnosed out there. And so what we're looking at is enabling you, giving you the tools to be able to sift through all of that stuff and find a way to customize it for you. Because especially today, when, you know, we have 50 million different diets, you have the paleo, you have the ketogenic, you have the Atkins, you have the South Beach, you have the vegetarian, you got the vegan. There's 50 million things out of there. And everybody is right for somebody at some point in time. The question becomes, what is right for you at this particular point in time? And what's right for you today is not necessarily right for you tomorrow. Right. So that's why we customize the program. And it's not something that we say, okay, you know what, here's your program, come see me in another 6 months. We say, here's your program, I'll see you in 2 weeks. Or I look forward to getting you texting me or emailing me and updating me, you know, because you were on there tracking everything on a daily basis as we tweak certain things to make sure that it was the right fit for you. And every couple of months, we reassess certain markers to see how things have shifted, and then we tweak the program again. So it's customized, it's accessible, because I'm accessible. You know, you're not going to go through 50 million different PAs, physician assistants. You're not going to have to wait in my waiting room for an hour just to see me for 5 minutes. I have what we call virtual online office hours every week. I have office hours in the morning and office hours in the afternoon. You can be at work and you can log in and say, hey, Dr. Gamble, I've got this issue, you know, or you can send me a text, or you can send me a chat through what we call our Embody 360 app. So I'm very much accessible. The other thing is that we look at resources. I connect you to various resources in your community, on the internet, books, anything that I can think of to assist you. And last but not least, education. My objective, because I'm an educator at heart. I've been so for over 25 years. Now, instead of teaching math and English, I'm teaching health and wellness.
Mhm.
But it all boils down to the same thing: empowerment through education.
Mhm.
And so that's where our natural health care program comes in. In
Mhm.
terms of the investment will vary depending on what kind of program is best suited to you and how extensive you want your support system. You know, if you say, oh, Michelle, I can just get the online course and I'm good, well, that's a minimum investment. You know, our seasonal cleansing program, it can be as low as $195. Or if you know that you have been dealing with chronic and complex issues for years, and it's going to take time and it's going to take constant coaching and constant education and constant looking at labs and things of that nature. We have a 3-month program, we have a 6-month program, and we have a 1-year program. So depending on how intense you need your support network to be, it can range, as I said, from anywhere from $195 to $4,000, depending on what your needs are.
Dr. Gamble, you were talking about the needs, and you were putting out it could be as much as 3-month program, a 6-month program, a year program. And I can recall the last incident with my son where we ended up coming to Sankofa after a 2.5-day stint at the hospital. 2.5 day, and of course that didn't it was a lot of testing, a lot of blood, a lot of all these kind of things. And when we're talking about an initial investment, we left the hospital 2.5 days later in the same condition that we were in when we arrived. But when he got his mail, because he's 19, 20 now. When we first came to you, he was 9. But he's 19 or 20 now, and talking about an initial investment, I think the most you said was probably $3,000 or $4,000. His initial investment per year for 2.5 days is $7,000 plus dollars.
Oh man.
But when we were 2.5 days, and of course we ended up coming to Sankofa. If you recall, I think we were there probably another 4 or 5 days. We came down in pain. They released us from the hospital in pain with no meds, with a script given to us at 8:15 in the afternoon. The pharmacy closed at 9, so we couldn't get across town. So he was in pain all night. He was in pain all the way up. But the fact that you got information from me over the phone on the way. I'm not advocating talking on the phone and driving by any means, but you were getting the information that you needed to begin to put together something so that when we got there, the episode could begin to subside. And I appreciate that. But talking about that initial investment, we have a $7,000 bill that he still has not paid. And the bill we received from Sankofa was minimal in comparison, but the benefits were maximum. I think by day 2, the pain had subsided, and he was getting back on track to dealing with the health issue that was presenting himself at the time. So thank you so much for just pointing that out, that, of course it does take a little to get what we need, but do you have any payment options since there's no insurance? What forms of payment do you accept?
Well, we accept cash and credit. And we also have certain installment plans, where you put down a deposit and then you have a monthly installment plan. And the other thing that I want you to really consider is, what is the cost of you not investing in your health? Because a lot of times we don't think about that. And I think we had spoken about that also, that not only did you get that wonderful $7,000 bill from the hospital, but you ended up taking, I think, 2 weeks off from work. And that is a lot of money. And then you think about the pain that you go through. As I said to you before, most of the people that will come to Sankofa, this is not their first stop. This is their stop after years of dealing with chronic issues, after hundreds, if not thousands of dollars spent on medications and 50 million supplements and 50 million tests. I mean, usually when people come to me, they've got tests up the wazoo, like you came to me with thousands of dollars of testing. And yet they send you off saying, oh, I don't know what to do with that. You're fine. But you don't feel fine, you know, or they give you umpteen medication and you feel worse after the medication than you were before the medication. So again, we need to think about the investment as it relates to how much it costs you to not make this kind of investment. And to really think about all of the costs, and not only for your person, but for your family. In your case, it was your son's illness that cost you time off from work. So how much time is your illness costing other people? How much money is your illness costing other people? How much discomfort, how much emotional stress is your illness costing the other people in your life, not just your own? And then when you add up all those costs, I think you'll consider that the investment at Sankofa is really minimal.
What about for those of us who have insurance plans? What about does Sankofa accept health savings accounts, anything like that, or how can I use those, or can we use those at Sankofa?
Well, those are things that you would have to take up with your particular accountant and the people on your job with regards to the restrictions of your health savings plan. Sorry, we will provide you with documentation and receipts, and who knows, maybe we're moving into a realm where they're going to become more comprehensive in terms of considering what they will accept.
So what about primary care physician? You know, that's the big thing now. It's hard to find a primary care physician. But do I need one, or does anyone need one in order to?
Oh, you definitely need to keep your primary care physician. I want to make it completely clear that we do not diagnose or treat any type of disease. We are here to support dealing with the root causes of imbalances, to give you nutritional support, to give you stress management support, to give you educational support, but we do not by any means replace the role of a primary care physician. And also, as you remember in your experience, as you start to get healthier, you're going to feel certain things start to go, and those are going to be times when you're going to have to check back in with your primary care physician and say, you know what, I think we need to lower the dose of this medication. Because, you know, for instance, if I can share a little bit of your story with your blood glucose, you know, after a while, your blood sugar started going down so low, and like, oh no, you're gonna have to ask them to take you off of some of that medication. So your primary care physician hopefully will be part of our healthcare team. And hopefully I'll be part of your healthcare team, because you have to remember that you're going to be the executive on your team. You're going to be the one in charge of this team, and you're going to have the responsibility of coordinating all of the different members of the team.
Yeah, because I mean, and that's something that you advocate, and that I noticed that you've advocated over the years, is that you wanted me to be more in control of what is happening with me when I go into talk with the primary care physician. Ask more questions, and don't just, you know, go along with everything he says. And so that's really, really good. And I thank you for just reminding us that, yeah, we need that individual on our team as well. But and so a little bit, can you tell me just a little bit more, that natural healthcare program, what exactly does it involve? I think it involves a lot more than maybe I've heard so far.
Well,
The six.
there's so many different layers of it, from the 21-day cleansing program, the various apps that provide you with menu plans and shopping lists and recipes and things of that nature. Then there is the unlimited access to virtual office hours. There's also a variety of different series of private one-on-one consultations. So there is our heart math coaching sessions in terms of helping you with stress management and increasing your resilience and your coherence. There's just so many different layers of the program. I really encourage you to go onto our website and to click on healthcare and to go and look and see all of the benefits of becoming part of our either health restoration plan or health assurance plan. And again, those will vary in terms of intensity of support as well as duration.
So what you're saying then is that if a person just says, well, I think that natural care may be for me, but I don't know. How do I know, or how do they know if they fit the criteria for the
That's
program?
where the preliminary consultation comes in. So during the preliminary consultation, we will look at what your needs are, what your goals are, and I will make suggestions as to which plan would be better suited for your particular situation. So for instance, I had a young woman come to me the other day, and she's dealing with SIBO, which is bacterial overgrowth within the small intestine. And I said, realistically speaking, we're looking at least 6 months to a year in order to be able to bring balance to that system. And so at that point, she has to decide whether or not she wants to invest at that level, especially considering she's gone from one practitioner to the other. And a lot of times, it's not that what they were doing was wrong, but rather that they didn't do it long enough, with enough intensity, and with enough comprehensive of a scope. And that's what we focus on doing, making sure that we tailor your program, that we're not just giving you what you want to hear. We all want to hear that this can be resolved in a couple of days, but that would not be me being honest with you. And unfortunately, some of us, our conditions will take a long time to resolve. And I'm just going to be very upfront with you about that, as opposed to leading you on a wild goose chase and bringing all of your expectations high, like, oh yes, we can do this in a month. And then you get upset and I get frustrated after it doesn't resolve in a month, when I knew very well that it wasn't going to resolve in a month. So, I'm very upfront with you. Also, in talking with you, I get to understand what your needs are in terms of how much support you need. And I'll be upfront with you about that also. If you need a coach that's going to be constantly, saying, hey, what's up? That's what I'm going to do. And that's a more intensive program.
Mm-hmm. And so what kind of, you were talking about the young lady, and you were telling her that it may be, 6 months to a year, to just bring things kind of back in balance. So what kind of budget, should an individual prepare with in order to have access to additional labs, supplementation, that kind of thing? What kind of budget should we just anticipate, just so we have a feel?
Well, in terms of the labs, as I said before, hopefully we can get the majority of those covered by insurance. And the other thing is that there is so much that we can do with food, so it really depends on the person. If you are open to changing your diet and your lifestyle significantly, that is the optimal approach to me. I don't like having to suggest 50 million supplements. And in fact, if that's what someone wants, I tell them to just go to the next natural health, quote unquote, provider, because that's not what I'm about. I'm about making your primary medicine be your food. And so what I tell people all the time is, you got to eat anyway.
That's right. That's true.
I mean, if you go to Mickey D's, you're spending at least what, $5, $10 per meal. So if you instead use that $5, $10 to buy things that are going to heal you, you're way ahead of the curve. And so to answer your question in a nutshell, it really varies. It depends on how extensive the damage is. It depends on how willing you are to change your eating habits and your lifestyle, to do exercise and things of that nature. All of that affects how much money you're going to have to spend in supplementation.
Mm-hmm. Yes, and of course we all know that it costs a little bit more to eat healthy, but it's worth it in the long run because, like you say, we got to eat anyway. So,
and just to jump in for a minute, that is, I think, a misconception that many people have, that it costs more to eat healthy, when in reality it actually costs less to eat healthy. Because if you think about how much you spend on processed packaged foods as compared to how much you would spend on whole food. So for instance, if I were to buy some potatoes, I would spend a lot less than if I went to Mickey D's and bought French fries.
mm-hmm.
But people don't think about it. Now,
Mm-hmm.
where the cost comes in is that, now I have to take the time to prepare the potatoes.
Mm-hmm.
Whereas at Mickey D's, it's convenient.
Mm-hmm.
And so you are paying a lot of money for convenience junk,
mm-hmm.
and it costs a lot less when you really decide to revamp your kitchen and to turn it into a whole foods medicine cabinet.
Mm-hmm. Okay, great. Thanks for just reminding me of that. I knew that, but thanks for reminding me. So I guess we're now where, how do they gain access to you? Can there interviews and their consultations? You live in Tallahassee, I live in Waycross, but we communicate really good. And so, but there are times that I wish that I were there, because I like that to look right in your face and then gain access to the colonics and things like that. But is it for an individual to start now? Can they have their stuff done over the web, over the phone?
Well, that's the beauty, as I said, of this age of technology. We have clients all over the United States, and we're able to assist you in ordering labs all over the United States. So it does not make any difference. And as you can see in this interview, we're able to have our consultations right here, and yes, we would love the personal touch, but it's a long drive between Waycross, Georgia and Tallahassee, Florida. But if you're up to the drive, we would love to have you to come into our wellness center. And like you said, you're able to take the benefits of certain other services like the colon hydrotherapy, which we offer only to our clients. And then we also have retreat opportunities where you get to interact with us on a more personal level. So there's that option. There's always the phone. We do a lot through HIPAA compliant text messaging, which goes through a process to make sure that your information is safe. So there are just a variety of ways for us to communicate and to interact in order for me to support you.
Okay. So we've gotten the first consultation, the initial consultation out of the way, and you have all of our information and paperwork, and you began to put together a plan of emotional, mental, physical, getting it all together. What should the individual expect then at the second and third consultations?
The second, the third, the fourth consultations, those are progress consultations. And so we take whatever has happened since the previous consultation up until that consultation, and we reflect and we review, we make adjustments as needed, and we make a plan for the next couple of weeks. It's always tweaking things, always getting that input, because in reality, I want you to always realize that you are the physician for yourself. You know yourself better than anyone with any kind of alphabet soup can ever know you. And I want you to get to the point where you believe what your body is telling you, where you believe what your heart is telling you, where you believe what your mind is telling you, because that intelligence within you will give you insight into what needs to be addressed in the health journey. And I want you to be able to start trusting yourself and bringing that information to the table. You may start doing research and you say, hey, Michelle, I noticed that I heard about this. What do you think about this? And so we constantly integrate and weave new information, new technologies, new testing, new experiences that you have into the plan in order to create a new plan for the subsequent weeks.
Okay. So it sounds like it's something that's ongoing for as long as the client
Yes.
needs your assistance, as long as they're willing to come on alongside or come on board and do what's needed
Yes.
to get to their optimal health. And so I'm sure there's somebody out there watching this, Dr. Gamble, that has heard the spiel and they're love what they're hearing, and they just need to know, what do I do now? You know, how do I don't have a phone number, I don't have a website, I don't have anything. So what would you say to that individual as far as how to get started with their journey?
Well, the best way to get started with your journey is to visit our website at www.sankofahealing.com and to just look around the site to see if you get a feel. I truly believe that in beginning this journey and in allowing us to be your assistants, to be your guides, to be your facilitators, it has to come from your heart. And I want you to feel led by your heart to choose us, to bless us with the opportunity to work with you. And so on the website, we have quite a bit of information, not only about our programs as it pertains to natural health care, but also the different things that we're doing in the community. You can also sign up for our newsletter. You can also sign up for our online workshops and lunch and learns and things of that nature. So that's where you start, in educating yourself about the possibility of working with us, and to take it into your heart and to ask the question if this is what is best for you, and to give us an opportunity to meet you through the preliminary consultation. So be sure to submit your metabolic assessment form. Once you go to our website and you click on natural health care, you'll see that there is a tab there to click on to submit a metabolic assessment form and to make an appointment for your preliminary consultation.
Well, there you have it, folks. I'd just like to say thank you so much, Dr. Gamble, for taking the time to answer those frequently asked questions that I know other people, I know I had them, and now all of you that are watching have them. Thank you again for your time. And again, folks, the first step is the best step toward reaching your optimal health. So make that decision today. Thank you. Have a great day.
Thank you very much. Goodbye.